Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation presented by Dr. Jack Rose, neurointensivist with Washington Township Medical Foundation. Dr. Rose is an expert in neurointensive care and cerebrovascular disease and was among the first 100 physicians in the world to become board certified in neurocritical care. He is also board certified in neurology as well as vascular neurology. In early 2014, Dr. Rose was recruited by Washington Township Medical Foundation to augment Washington Hospital's comprehensive stroke and neurosurgical programs. He is now the co-medical director of the Washington Hospital Stroke Program. Please welcome Dr. Rose.
Hello, it is my pleasure to talk to you about warning signs and prevention of stroke. Stroke is a major health problem in the United States as well as the world. In the United States alone, almost 800,000 people experience a stroke every year. Stroke is the 5th leading cause of death in the United States, and that translates to one American dying of stroke every 4 minutes. We have over 5 million survivors of stroke, and stroke is the leading cause of adult disability. It is also a disease that leads to an enormous amount of healthcare expenditures. It's estimated to cost the United States government well over $30 billion per year. Up to a fifth of stroke survivors are institutionalized still within 3 months after their stroke, and 20 to 25% of people die within a year of their first stroke. Might be slightly higher in women than men. Only about 50 to sometimes 70% of people that survive a stroke are able to fully regain their functional independence after a stroke. And different ethnic people of different ethnic backgrounds have increased risk of stroke compared to others. For example, African Americans in the United States have 50% more strokes than Caucasian Americans and twice as many as Asians and Hispanics. Women are affected by stroke more often than men in terms of surviving a stroke, and stroke kills more American women, more than twice as many women are killed by breast cancer. And those women who are over age 30 and who smoke have the highest risk for having a stroke. Well, what is a stroke? Stroke is, a simple way to put it, a brain attack. So as opposed to a heart attack where you have a problem with blood flow to your heart, stroke is a problem of blood flow to the brain. And so it is a disease that affects the brain function. And it is an emergency. Just like a heart attack, a stroke is a medical emergency. And if you or somebody you love or take care of or standing next to are showing signs of a stroke, you need to call 911 to get that person or yourself to medical attention as soon as possible. A little bit more about what a stroke is. A stroke occurs when the blood flow to the brain gets disrupted, either from a blocked artery, which are blood vessels that bring blood to the brain, or a broken artery, for example, an artery that breaks inside the brain. And the brain tissue that's supposed to get blood flow from that diseased artery can die if the blood flow is not restored. There are two main types of a stroke. The most common type of a stroke is what is called an ischemic stroke, or a blocked artery stroke. This is about 80% of strokes. That's when you have an artery either in the neck or the brain that gets blocked, and the part of the brain that's supposed to get blood flow from that blocked artery no longer is getting blood flow, or it's impaired. This is a cartoon diagram showing you what that might look like. This cartoon diagram here is showing you these red tubes. These are representing the arteries bringing blood flow to the brain, And you notice here, which is blown up in this little circle below here, there's a clot. There's abnormal blood cells and cholesterol buildup material that's blocked this segment of this artery, and the area of the brain beyond that blockage will be injured from that blood clot blockage unless it's opened up. Strokes can be small or large in size. This is a picture of a CAT scan, an X-ray picture of the brain days after somebody that has had a small blocked artery stroke, and you see that there's an area of black over here where the normal brain tissue should be gray, and this is an area of loss of brain tissue in that region. This is a relatively small area of the brain that was involved, and somebody, a person experiencing this stroke, could fortunately recover a good degree or even fully after some time and rehabilitation. However, strokes can also be quite large. For this patient, on the other side of the brain, you notice there's a very, very large area of darkness where it should be gray. This represents a very sizable stroke, something that might lead to the patient's death or permanent severe disability. You see that it's almost covering about a half the area of the whole brain on that side, and it's actually pushing the middle part of the brain over to the other side. The other type of stroke is a bleeding type of stroke, where we call that hemorrhagic stroke. That's the remaining 20% of strokes. And that's where you have abnormal bleeding into the brain or the fluid spaces inside the head from a broken blood vessel or an aneurysm, which is a blister on a brain artery. Bleeding strokes, just like blocked artery strokes, can be small or can be large. This is an example of a small bleeding stroke where you have a small artery that's broken and it caused this area of bleeding into the brain tissue relatively small. This would cause somebody to have very, very severe headache, some temporary disability, but they could recover quite well with some time. And the most common cause of a small bleeding stroke deep in the brain like this would be uncontrolled high blood pressure. But bleeding strokes can be very large as well. This is an example of a much larger bleeding stroke. This large round area of bright white inside the brain on this CAT scan picture, it represents a much larger area of bleeding stroke, and somebody may not be able to survive a bleeding stroke of this size. Or if they do survive, they would be left with a significant disability. And this can also be caused by high blood pressure or a number of other causes, which we'll review in a minute. Well, what are the causes of bleeding strokes? Most of the time it's due to long-standing, suboptimally controlled high blood pressure. But there are two other things that can lead to bleeding strokes. One of them is called a brain aneurysm. That's where you have a small ballooning or a blister of one of the brain arteries that grows over the decades of somebody's life and can break. And there's another main cause that are called AVMs. That's a cluster of abnormal arteries and veins connected in a way that leads to this AVM that can break. This is a cartoon diagram showing you what an aneurysm might look like. The normal artery here is this dark red tube with some of its normal branches coming off of it, but you notice that there's a rounded sort of blister, a sphere, that has another secondary outpouching here. This reflects a weakness in the artery wall that was present since birth and has slowly grown over the many decades of this person's life and eventually breaks and causes bleeding into the fluid spaces. This is called a subarachnoid hemorrhage from a broken aneurysm. We fortunately have surgical treatments both inside the artery itself and outside the brain artery through neurosurgery to treat such types of aneurysmal bleeds. The more common type of bleeding stroke can be just caused by a small area of damage to a small artery that causes bleeding to directly go out of the abnormal vessel, oftentimes at branch points between larger arteries and smaller arteries. We don't have surgical treatments for this type of bleeding stroke. Are there any warning signs that a stroke, either blocked artery or a bleeding stroke, might happen? Well, for blocked artery strokes, the more common type of strokes, oftentimes, but not always, you can have a warning sign happen before the permanent stroke occurs. We call these TIAs, or transient ischemic attacks. It's like a stroke, but it doesn't lead to permanent damage. It's where blood flow to the brain, one part of the brain, is temporarily blocked, but then restored in a short period of time, often spontaneously. TIAs are very similar to a stroke, but the symptoms resolve very quickly, typically minutes and less than a few hours. TIAs are also quite common. They occur up to 250,000 people every year in the United States. And if you have it, somebody has a TIA, they're up to 10 times more likely to have a stroke, especially within the first month after having that TIA. So TIAs are medical emergencies just like stroke. So even though someone's symptoms may fully resolve after a number of minutes or hours, they should still seek out emergent medical attention. So what are the warning signs of stroke or TIAs? Well, it's sudden numbness or weakness of one part of the body, the face, the arm, the leg, or all parts of that side of the body. And it's especially affects one side of the body. Or you can have sudden inability to speak well or have trouble understanding speech. A person experiencing a stroke might seem confused or be speaking words that are not real words. Suddenly people can lose vision in one of their eyes. That can be a sign of a stroke. Or sudden inability to walk or to be able to balance, to stand up, or sudden inability to coordinate movements of your body. And then those are blocked artery stroke symptoms. In terms of bleeding stroke warning signs, oftentimes it's sudden severe headache without an unknown cause. Sometimes people describe this as being the worst headache of their life. How can you remember these signs and warning signs of a stroke? Well, there's a great acronym, a tool that you can use to remember what the symptoms of stroke are, and we call that B.F.A.S.T. So B stands for balance. So if suddenly somebody is unable to balance, either standing up or walking, that could be a sign of a stroke. E is for eyes, so sudden loss of vision in one eye especially. F is for face. If suddenly someone's face cannot move on one side, their smile is uneven, suddenly their face droops or they start drooling out of one side of the corner of their mouth, that can be a sign of a stroke. A is for arm. So if suddenly someone's arm becomes severely weak, or their leg, for example, that could be a sign of a stroke. S is for speech. If somebody's speech suddenly gets slurred, or they're using words that don't make sense, or they can't understand language, that is a common symptom of a stroke. And then T stands for time, because stroke is a medical emergency, and the faster you can get to medical attention, the better your chance of getting a stroke treatment therapy and getting a better outcome. And like I said before, stroke often affects one side of the body, especially the most common blocked artery type of stroke. So this is a cartoon diagram showing you what might happen if you have a stroke on the left side of your brain. Things in the brain are crossed for the most part. So the left brain controls the right side of the body, the right brain controls the left side of the body. So if someone's experiencing a stroke on their left side of their brain, you might see weakness on the right side of their body, their arm and their leg. As most people's language function is in the left side of the brain, people with a left side brain stroke will often have problems with their language. People with a right brain stroke, on the other hand, will oftentimes show symptoms of weakness on the left side of their body, and they may not even be able to recognize the fact that they're weak on that left side, or they may not pay attention to the left side of their body or even anything happening in the left side of the world. And that's because the right side of your brain is more involved in orientation and sort of understanding the spatial relationships of your body and with the world. Sometimes when you call 911, the EMS people will do a standardized set of tests looking for signs of stroke, and they will evaluate someone for a facial drooping with any drifting of an arm showing you some weakness, and for their speech. And in order to assess facial symmetry and strength, they'll just ask the person to show them their teeth or have them smile. And normally both sides of the face should move equally, or the smile should be symmetric. But if abnormal, that would be a sign of a stroke. This, for example, is a person being asked to smile, and you see that the right side of the patient's mouth is not moving up as they're asked to smile. So this is showing some weakness of the right side of this gentleman's face. In terms of the arm strength, one way you can ask somebody to see if their arms are weak is to have them lift their arms up and close their eyes and keep their arms upheld for 10 seconds. And normally people should be able to keep both of their arms up and not have their arms move down. But if there's significant weakness that you might see in someone experiencing a stroke, one of the arms may drift down either slowly or rapidly, depending on how weak they are. So this is an example of a woman who's asked to hold up both of her arms and close her eyes, and you see that the right arm is starting to drift down. That's a sign of some mild weakness on the right side. Sometimes the weakness is so profound you can't even have the person lift up both of their arms together. And in terms of speech, commonly you can ask somebody to repeat a sentence in whatever their preferred language is. So for example, you could ask them to say, "The sky is blue in Cincinnati." And normally, if someone's not having signs of a stroke or a warning sign of a stroke, they'll be able to repeat the sentence without slurring of their words and with good repetition. But if the person slurs their words, says the wrong words, or can't speak at all, that can be a common symptom of a stroke. So again, if you suspect a stroke in yourself, your family member, your friend, just somebody your coworker or someone you're next to, you should call 911. Don't wait to see if the symptoms get better or drive yourself or have a family member drive you to the hospital. You should call 911 and let the EMS and medical professionals come assess you and take you to the hospital as quickly and safely as possible. Time lost is brain lost. That's a saying we say in stroke care, because the faster you can identify the stroke and get someone to medical attention and potentially get treated, the less brain damage that that person will experience. So you want to get to medical attention as soon as possible. And in fact, some of our treatments for blocked artery strokes are very, very time sensitive. For example, the most effective drug that we have to treat strokes from blocked arteries is a medicine that has to be given in the emergency department in an IV, and it has to be given within 4.5 hours for when the stroke symptoms began. So it's very, very small, tight treatment window. So the fastest you can get the patient to the hospital, in the emergency room, to get assessed and potentially treated, the much better their outcome will be. And if they are not within that treatment time window, they won't be a candidate for this type of life and disability-saving medicine. Once someone's been diagnosed with a stroke and treated, hopefully at the onset, there are other ways that we can prevent future strokes with a variety of different medicines or surgical procedures that can be done to prevent future strokes. And then in terms of bleeding strokes, it depends on the type of bleeding stroke, where the bleeding is located, what the underlying cause is. And for some of them, like aneurysms, we have outstanding neurosurgical therapies, most of the time minimally invasive these days. We can put little metal coils inside that ruptured aneurysm without doing a major brain surgery. Washington Hospital is a primary advanced certified stroke center, and we've been so since 2007. And we have very strong programs in the hospital, and we work with nursing and rehab facilities, as well as outpatient therapies and therapies that can be done at home to get the best recovery for our stroke patients. In terms of the things that you can do to try to minimize your risk of stroke in the future, some of the things you can't control. So the older you are, the more chances you have of having a stroke. Sometimes women are at slightly increased risk for stroke than men. Certain ethnic backgrounds are at increased risk for certain types of stroke than others. And then if you've had a past stroke, you're at increased risk for stroke in the future. So these are some risk factors for stroke that you can't modify, but you can know about them and then make sure that you do everything possible to protect yourself against stroke in the future. There are some medical conditions that contribute very much risk for stroke that you can do something about. So hypertension is one of the largest triggers or contributors to stroke, both blocked artery strokes and bleeding strokes. So if you have high blood pressure, you should know about it and review with your doctor how you can treat that very aggressively and to keep your blood pressure normal at all times. High cholesterol is another condition that can contribute to your increased risk for a blocked artery stroke. Smoking is a very large risk factor for both bleeding and blocked artery strokes, and quitting smoking can significantly decrease the risk for stroke. If you happen to have atrial fibrillation, which is an abnormal heart arrhythmia where the top part of the heart quivers at times or all the time rather than beating in a regular fashion, that predisposes people to having clots build up in their heart, and then those clots can go up to the brain. This is a very common cause of stroke in older individuals, especially in their 60s, 70s, and older. So if you have atrial fibrillation, you should be on some blood thinner medicines to prevent the clots from developing in the heart to begin with. And then alcohol use, especially moderate to heavy alcohol use, are big risk factors for stroke, and so the minimal or no use of alcohol in someone that has risk factors for stroke will really help protect people against stroke. So prevention is the most important goal. We don't want to ever have to treat you for stroke. If you have a stroke, we can do a lot of things to treat and prevent future strokes, but we want you to never have a stroke in the first place. So make sure you see your doctors regularly. Make sure you know if you have high blood pressure, and if you do have high blood pressure, make sure you're on the right medicines and taking them as directed. And follow your blood pressures at home and keep a record of it for your physicians or other healthcare provider. You also want to make sure that your weight is good, you exercise regularly, you eat healthy, and definitely stop smoking or don't drink alcohol heavily. These are just another summary slide of all the controllable risk factors that are very, very common with stroke. And one of the things I didn't mention is diabetes. Diabetes is a large contributor to blocked artery strokes as well. So if you have diabetes, that is something you want to aggressively control with your medical doctor. So what have we reviewed about stroke today? Well, we've mentioned that it is a large contributor to death and disability in the United States and the world. Fortunately, it can be detected early, and everybody should learn the warning signs of stroke and how to recognize it. Fortunately, most strokes are treatable, but time is critical, and stroke is a medical emergency. So you should know the warning signs of stroke. Remember this B.F.A.S.T mnemonic, or even get one of these B.F.A.S.T cards to put up on your refrigerator, or make sure all your friends and family know about it. Sudden inability to balance, sudden problem with your vision in your eyes, sudden weakness of one side of the face, sudden weakness of one arm, sudden speech abnormalities or language trouble, sudden severe headache. And remember that this is a medical emergency and you need to get to the hospital as soon as possible. And if you suspect a stroke, don't try to self-diagnose. Don't drive yourself or a family member to the hospital. Instead, call 911 immediately to be taken to the closest stroke center. To learn more about our hospital stroke program, you can also visit our website at www.whhs.com/stroke. And again, this is that B.F.A.S.T mnemonic that I hope you all know about and will learn. And keep in mind if you see something happening in yourself or a loved one or a coworker, so you can identify a stroke and get someone to medical attention as soon as possible. And you can also look up information about stroke at the Stroke Association website, which is a sister organization of the American Heart Association. And this is a phone number you can call as well to ask questions. Stroke can be prevented by using the knowledge that we've reviewed today to make good choices in your life, to keep yourself as healthy and lower your risk for future stroke as much as possible, and to maintain a very healthy and fruitful life in the future. We can prevent, treat, and take good care of our health. And thank you very much for paying attention.
Thank you, Dr. Rose. We do have a couple questions. The first question is, do we know why there's a larger percentage of women than men who will experience a stroke?
We don't know exactly why. Now, it's not a large difference between women and men. Women, even today, tend to live longer than men, and age is one of those risk factors for stroke. So it may be that women tend to live longer than men do. And in the past, women's health has not necessarily been as well studied as men's health, and so sometimes in the past Women have maybe not been given as many opportunities to lower their blood pressure or take certain medications. So I think it's most related to the longer lifespan of women on average and some past disparities in terms of how seriously medical conditions are taken between men and women.
Okay, thank you. Our next question is, if someone experiences a TIA or warning sign to a stroke, is there anything they could do to prevent that stroke from happening in the future?
Oh yes, absolutely. And that's why we say that if you have a TIA or a warning sign of a stroke, you shouldn't just say, oh, I'm glad that these problems didn't last very long. You really need to get to the hospital and get evaluated, because the warning sign of a stroke could have been due to a narrowing of one of the arteries in the neck, and you might benefit or be a candidate for a surgery to open up the blocked artery. Or you may not know that you have abnormal heart arrhythmia, and you might be able to stave off a permanent brain damaging stroke by being put on a blood thinner medicine. Or you may not know that you have severely high blood pressure. And so there are lots of things that you can do, even if it's just a very short-lasting temporary warning sign of a stroke, so that you can prevent that future permanent brain injury from happening.
Thank you. This does conclude our program, and thank you, Dr. Rose, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.